I'm pleased to welcome Jane DeBro from the Area Agency on Aging here in Dane County. Jane is the caregiving specialist, or rather caregiver specialist, right? She works with caregivers. Jane, could you tell us a little bit about yourself, and then launch into your program, please?
Yes, good morning, everybody. I'm thrilled that you're here. I am, as Mike said, the caregiver specialist for Dane County. And I have been in that position now. This is my 10th year going in. The job that I have really involves both administering the National Family Caregiver Support Program. I'll put that in context for you a little bit more in a minute. And I also do the hands-on case management with people who are applying for the grants and for helping them do some planning and helping do some education and outreach regarding family caregiving. So we're talking about family caregiving here, which I'm sure that makes sense to you. There's a whole other part of very closely allied professions, which are the people who actually provide the care. And so for Dane County, I know there's some of you coming from other counties. If you're familiar with Wisconsin, you know there's 72 counties. In Wisconsin, there are 3 AAAs. One is Dane, so we are our own AAA, and one is Milwaukee, they're their own, and the rest are under GWAR, which is the Greater Wisconsin, I believe, Area Agency. I'm going to get it wrong. I'm going to get the acronym wrong. I apologize. But they oversee all of the rest of the counties. So people often get confused, I think, between who they're calling in Dane County, between the Area Agency on Aging and the ADRC. I will always tell everybody everywhere in any county to call your ADRC first. They are the people who they're on the phone. They usually would have phone hours, I think, every single day, and that they have a job of being able to direct you to the professionals you need and also to offer just a wide variety of programming. So if I were a caregiver to call into Dane County ADRC, they could talk to me, find out a little bit about what I'm looking for, and they would either send you directly to me because you are interested specifically in a caregiver grant or something in this program, or they might be able to talk with you about a number of other programs that they are much more well-versed in than I am or a person in my position. So I will leave you a phone number. You can have my email. You can contact me directly. But I often tell people, go through the ADRC. If there's only one number you need to have in your head and something's going on in your life, give them a call. And their job is to give you that assistance and information up front. So I sit in Dane County's Area Agency on Aging. The mission of an Area Agency on Aging is to implement the Older Americans Act plans. So this is something that came into effect way back in 1965 under Lyndon Johnson. They are programs that sadly have not been funded a whole lot more robustly since that time. So we are doing things like overseeing the caregiver program is one, there's the elder benefits specialist, there's the nutrition programs, there is volunteer programs. There's just a lot of programming that comes under the AAA. And then, like I said, the ADRCs, it's their job to get people information and assistance and will get you to the professionals you need. If they can't do something for you, they'll get you to someone who will. Let's see. Oh, there we go. So the Caregiver Program at Dane County is part of the National Family Caregiver Support Program. This program serves unpaid family caregivers, and there are 2 sections to that. So we are looking at older adults who need care, and so that caregivers of any age can apply for help from this program, as long as they're over 18, I should say, adult caregivers of any age, who are caring for someone who's 60 plus, and we mean frail people. So I am 60 plus and my child cannot get a grant to clean my house. This is for people who are truly living on their own in their homes, but need some extra help. Sometimes people who are 60 have had an issue and they do need the help. So that's our age of entry. Or someone of any age with Alzheimer's or dementia diagnosis. Sometimes, as we know, sadly, early stage cognitive decline. Alzheimer's can begin much younger, and so those caregivers are also eligible. Then there's the second part of our program, and these are older adult caregivers who are caring for younger people. One are parents or grandparents and relative caregivers age 55 plus, and they have to be related. They don't have to be grandparents, but they have to be related. They're caring for a child who's 18 or under, and or they can be caring for a lifelong severely disabled adult who's lived with them all their lives and is age 18 to 59. And that can include the parents. So we're now getting to a stage where we're looking at a lot of older parents who are over 55, whose children have been given excellent care despite disabilities. People with disabilities are living much longer with certain things that they didn't. And now older adults are looking at how can they continue in their older age to provide care for those children. So part of what is the big overarching thing they're looking at now, because this program has just run since 2000 on a very slim budget, just sort of going with those parameters. Right now, there's a national strategy to support family caregivers. And that is the discussions that are beginning to take us through what are we really going to do? Some of you may be aware that Tammy Baldwin and Susan Collins a while ago got some legislation through called the Raise Family Care Act. They're trying to look at what we can do. That wasn't funded for a long time. Now there is some money, and what we're doing at this point on the national level is having discussions on best practices, on recommendations. And for anybody who's interested, you can contact me. I can give you links to any of these plans and programs so you can see what's being discussed. And there are also options for you to provide input. So we're working on increasing awareness and outreach, part of what I'm doing today. We are trying to build partnerships and engagement with family caregivers, strengthen the service and supports that are available. Workplace security is a big part of it, so that's part of the discussion, financial security for caregivers. And then to expand data and research and make sure that we are working with evidence-based practices. And I'm sorry, you guys, I took an antihistamine this morning. I apologize for my dry mouth here. And then there are 4 cross-cutting issues that we're looking at as well. And that is, these are person and family-centered approaches. So when I work with a caregiver, I'm really working with them, their family, their needs. We're starting to take some consideration into trauma and its impact. And one example I can give is, happens a lot with grandparents raising grandchildren. I have a grandchild. If I think of what would have to happen in my family for my granddaughter to need to live with me and be raised by me, there has been some trauma there. The child has lost a parent is incarcerated, a parent may have issues with drugs or alcohol and be unable to parent. So we're trying to also make sure we are careful to take that into account. Diversity, equity, inclusion, and accessibility. Those words kind of, I feel like, have been around so much they can kind of lose their meaning for us, but we're just remembering here that we are trying to reach underserved communities of all kinds, of people who have not been helped in these areas and who really need the help the most. And then, like I said, the partnership with looking at the direct care workforce, which was really impacted by COVID. I'm sure any of you caregivers on here, if you've hired any kinds of help, have seen the costs go up, have seen how difficult it is sometimes to be able to hire people who are professional caregivers to come in and provide you with some extra support. First principles, I'm not going to take a real long time on this, but really what I want to say we're looking out for is, I'm looking always at the caregiver, what their background is, what their needs are. Then look at the person who is receiving the care. Now, with this program, the person receiving the care qualifies the caregiver for the program. So in other words, you're taking care of one of those people we discussed, either an older adult or a child or grandchild. But the object of my attention and who I'm trying to help is the caregiver. And that comes into play in a situation where sometimes someone will call me and say, my mom needs someone to do her housekeeping. And then we get into a little bit of a conversation about what's going on. Maybe that caregiver is raising children. They're trying to do all kinds of things for that parent. They have a lot going on in their lives. And we will sit down then and pull apart, but what is your need? Maybe your need as the caregiver is to hire some help for another area. Maybe it's to give a shower. Maybe it's a break that you need for some reason. So this program will always provide its attention and focus on the caregiver itself. We're also looking at things like the length of caregiving, and then that would be caregiving characteristics, the experience, do people need training, looking at that larger area, and then the context. So what's the living situation? How close are people? What are the financial resources? So when I'm looking at doing a caregiver assessment, and what the assessment mostly means is you as a caregiver and I are talking together about your situation and filling out the actual application for the grant. We are looking at everything in this context and focusing on what the caregiver needs, and of course, benefiting the loved one who needs the care. But the eye is on really keeping that caregiver healthy and functioning to the best of the ability we are able to do that. Really quick, won't read this whole thing for you, but the National Caregiver Champion Collaborative is part of what I am working with. And that group is national. It's everybody like me all across the country is able to join in part if you've been, working at this. And we have discussions and we talk about what's going on and what kind of recommendations are we going to make at the national level. So for a moment, I forgot talking about my big picture stuff to tell you a little bit about who I am and where I come from in terms of this. I told you what my position was. I am a person whose primary profession for the first many, many years of my career was a writer and an editor. Last job before I came here, I was the editor of Wisconsin Magazine of History for the Historical Society. But an interesting thing was happening there. And I was looking at coming to a point in my life where I wanted to do an encore career, something really different. And what I noticed were my colleagues, sometimes sitting in the hallways, sometimes, would talk to people at lunch. And I started hearing about caregiving and how they were trying to juggle caregiving. And I thought, somebody must be helping these people. And I want to be one of those people who are helping and supporting these people. So that put the idea in my mind. I went back to school just online and got a year-long certificate from the University of Washington in Seattle in gerontology. Not sure at first. I thought I was going to end up writing about it, right? That would make the most sense for what my career was. But I ended up working in this position and I have loved it. It has been really wonderful. I'm also personally a caregiver for my father until he passed away. My mother is 91 years old. She is living in an independent situation, but her children are essentially her assisted living. So I can really relate to caregivers. And so I have some personal experience as well. So that's how I came to this field. The caregiver program, that is the grant part of the program, that begins every year on the calendar year. So in December, and I tell people December 16th, but in the middle of the month, and my number comes at the end of this, you can call me. We'll begin to set up assessments for 2025. Funding for 2024 has already been spent, so we do not have that. I will say that it's going to be a little challenging this year because we had a lot of money the past couple of years from the American Rescue Plan Act, which came, via COVID, and we had double the money to give people that we have now. So one of the things that we are going to do is focus a little bit more on sustainable caregiving. And that's where this came from, to really help people get a hold of how they can plan for things, how they can use the grants to get themselves established with some services they need, and then how they can look at how are you going to sustain, because the average caregiver can care for as long as 4 years. And if you're taking care of a person with dementia or Alzheimer's, it might be a whole lot longer than that. So for the grants, the National Family Caregiver Support Program grants, there are no financial eligibility requirements. We do try to make sure we reach out to individuals who might be in underserved or low income areas, but there is no financial reporting that you need to do. If you need a grant, you talk to me and we put you through. How we tend to do it is just first come, first serve. We start taking people and assessing, and we assign them money until we don't have any more money, is pretty much how we do it. Since COVID, one of the things that is new is we used to have to pay a service provider directly. So if you're a caregiver and what you wanted for your care was to purchase transportation or to have senior helpers or a Bright Star or someone like that come in, do some care, we used to need to set up a whole grant to pay them directly. Because of the shortage of care providers for a while, they changed this grant, and now you can hire someone if you want. Hire, I would say pay, use these funds to pay a family member, or the caregiver themselves can take this money. And where this has been really useful is in Dane County, because of our systems and our large accounting system, we didn't have the ability to do more than one service provider with the grant. So let's say you wanted adult daycare for a spouse or for someone, and that's what you were going to apply your grant to, then you didn't have the choice to do other things. And so now if you get it paid to you directly, and let's say you have a niece who's willing to do it, and you have someone from church who could do it, and sometimes you want to pay a professional from one of the agencies, you would then be in charge of your money. You would never have to report it or anything. Once you get through the assessment, we would pay that directly to you. And then you would be able to use those funds as you need for whatever you want that applies to your caregiving. Respite and supplemental services. Respite really is the things that allow you to take some kind of a break. So that's someone coming in and doing, chores. There's someone giving transportation. There's someone caring for your loved one while you take a vacation. Supplemental services are things like these funds can be put towards home modifications. They can be put towards a personal emergency response system, things like that. So it's really, really broad. And particularly when we're looking at grandparents raising grandchildren, we've done things like tutoring for kids, getting kids their sports equipment that they need to participate. So we've been very lucky in that we can do just about anything if we can sit down, work it through, and get your paperwork through for you and make sure that you get what you need as a caregiver to be able to provide what you need for your loved one and care for yourself. As I said earlier, the focus is on the caregiver's needs. So I am looking at you when you're the person who calls. I do want to clarify when you're saying who the caregiver is, that you are qualified by the person who needs the care. So if you live not in Dane County, but your loved one does live in Dane County, we can help you there. So you still would be qualified by your loved one in Dane County for that care. If you were a person who lived in Dane County, but your mom lived in Brown County, I could help connect you with my counterpart in Brown County. So that goes by where the person who is the recipient of the care lives. What is sustainability? I think, I alluded to it. We're really focusing on meeting the needs of the present without compromising the ability of future generations to meet your needs. And I'll tell you what I mean by that. There was one young woman who was a caregiver client years ago who was taking care of children and her disabled parent and her grandparent with dementia and worked. And it was like at some point, what was being asked of this young woman was not allowing for her children to thrive as they need to as well. Yes, she had these other obligations and did it lovingly for the people who needed care. But somewhere in there, we can't sacrifice caregivers. And that is my big passion, is like, how can we support people? Caregiving is hard. It takes a lot, but we don't have to sacrifice our caregivers. We don't have to do this on the backs of the people providing the care. The concept, it's economic, it's environmental, and it's social. And I did want to point this out. I was just on, it was a silver economy forum. It was talking about economy, but this just really hit me. Caregiving is larger than any single occupation in the US. So you are not alone. It's a ginormous economic issue. In Wisconsin, 580,000 family caregivers, and these numbers are from AARP, and as recently as 2023. 540 million hours of unpaid care is being provided, and they're only doing it at 16.97%, 97 cents economic value per hour. $50 an hour is what you're going to pay here, probably an hour at a time. So that's not even a close, really, estimation of what family caregivers are truly providing. And this too, this is what the average is that caregivers are putting out. 78% are paying $7,242 out of their own pockets for expenditures. 26% are, spending a quarter of their annual income on caregiving expenses. So this is a program, this is an area that really, truly is going to continue to need expansion. And also, in terms of the environment, the larger environment, 70% of those age 65 and older will require long-term care at some point. And that means that 42% Medicaid only covers that much of all of that need. So this just gives you, the 475.1 billion is what gets spent by Americans out of their pockets, and 3.2 years is the stay. We used to say is the length of the caregiving, of the stay in long-term care, and about 4 years of someone doing caregiving in the home. 90% we know of adults over 65 really want to remain in their homes as they grow older. At least half of older adults can expect to need care during their older years. And the median average for home health aid is $5,148 a month. This grant requires that your care recipient, if they're an older adult that does not live with you, live in independent living. They can live within a larger community that has levels of care, but they would have to be in the independent living part. They can't already be receiving services. So people on assisted living would not be eligible for the grants. We can still help people with other areas, but not with the grants. We know this, caregivers have higher stress levels. They're more likely to suffer health problems. So that's also something we're trying to address. So we're looking at the social aspect next of this sustainability idea. And one thing that does come into play, I notice when I talk to people, is the quality of the relationship and caregivers' perceived choice. If you are taking care of an adored spouse of 45 years and your relationship has always been very good, the attitude towards the caregiving is very different than someone who has had is now being pulled into care for a parent for which they've had a really rocky relationship. And so we look at what kinds of stresses the caregiver may be under in their individual situation. How much family community support? I mentioned my 91-year-old mother. I am also one of 5 of her children. So it isn't that huge a hardship in many ways because we divide that up between 5 people. How much community support is there? Are there people in your loved one's neighborhood or yours if you're a couple? Is there someone in the neighborhood? Are there community groups that you can turn to that can also provide you support? That is really important. And that would be part of what I would be encouraging as we look together at how you are going to proceed through your caregiving journey. And then caregiver education and knowledge, which is just simply do you know where your resources are? Do you know how to find them? if you need some kind of education, how can we help you get to that education and knowledge? When I mean that, I say, do you know anything about the disease process for if your loved one has just been diagnosed with dementia? Perhaps we're going to recommend you talk to the dementia care specialist for the county. So how do we do this? Make it sustainable. That's what we're really trying to focus on this year since our grant funding is smaller. And this year we're going to look at first, last year I had a long wait list of people who didn't get to grants. So this year what we're going to do is put those people up a little further, give them first crack at it. So if people have been on that list waiting, we're going to contact them first if they're still caregiving and see if we can help them out, and then take everybody else as they come in. But we want to make sure that we are reaching out to as many people as we can. I have anywhere between 70 and 80 grants to give for the entirety of Dane County. So we're not going to cover, the number of people who may need this, but we're going to deal with as many people as we possibly can and help them. And then there are other places to go for some help that I will mention at the end as well. So how are we going to make it sustainable within our program parameters, which I said? So we talked about the funding. And for 2025, I'm sorry, I've got a screen ahead of myself, so that's what I mentioned. We are going to try and make sure that we get to as many people as we can for grants. Planning is something we're going to put a lot more emphasis on, and we always have. So we're going to talk to people a little bit about when they call, what kind of things are they looking for? For a caregiver, not a lot is under your control. When my father was still alive, he was in his 70s, he really resisted considering what they might need in the future. That was hard, but all we knew is we could do as the caregivers, the children, what we knew. So we did things like go to our workplaces, look, see what were our FMLA policies, look at the things that you would have for your life and support, begin to see and talk to other family members who's around, have a sense of who the people were at my parents' church, begin to know a little bit more about what maybe you'll be looking at if you strongly suspect that your parents or your loved one might be coming up to a place where they would need some kind of care. This is what I told my dad, and this is where we went. To avoid or refuse to plan is to be left to react to a crisis. And very sadly for my dad, that's what happened. He had a health crisis that when that time came, he didn't have the choices he would have liked as to what would happen next, what facility would have a place for him, etc. I know this is a really dramatic picture, but for any of us who've had a loved one who is suddenly, who was managing and then suddenly they weren't, that's what we're trying to plan for if there's any way to do that. Some other things sometimes happen where people are doing great, they're going along fine, and then we have something that takes someone from independent to requiring care. So they have a stroke, they have a cancer diagnosis, maybe an anesthesia reaction. I've dealt with caregivers whose loved one underwent a 10-hour surgery and then had some cognitive issues as a result of the anesthesia. There are things we can't always plan for in life, but then they're there. And the caregiver might accelerate from being just a support to very active caregiving. So maybe you were bringing meals once in a while, or maybe you were coming to help with some lawn chores and some doctor's appointments. And then suddenly there might be a fall and a broken hip, or there might be an Alzheimer's or dementia diagnosis. And those things will take the caregiver suddenly from one level to a much more involved level of providing care. So when you're looking at aging in place, which is more of the contextual for all this, and this is also part of the planning, is what's the location in terms of proximity to people who can help? What's the location, proximity to the kinds of things that your loved ones may be looking for? And when I'm talking about this, I'm talking much more obviously not about the children, but maybe more about taking care of older adults. What kind of transportation options are there? If they're living in a house, an old house circa 1920, and it's 2 stories, is there modifications that can be made? Or maybe is this the time to look at a different kind of an option? There's driving retirement to think about, and I get tons of questions about this, and I have some good resources if anybody here is looking for that. But at some point, people will begin to need different kinds of transportation options because maybe night vision has become an issue or any other number of issues. So it's nice to kind of know what will happen if for some reason that ability to transport themselves or yourself changes. I like to tell people that caregiving is a marathon, so pace yourself. The average duration is 4 years. Only 30% of caregivers provide care for less than a year. So it is a long-paced thing. So make sure that, self-care is part of what you do. It's a relay, pass the baton, have people in your life. I mean, I have incredible fortune of having a sister and 3 brothers that we can do this. But are there other people maybe in your life, siblings of the parent? Are there friends? Are there neighbors? Just for any little bits of help and support you can get. And then the next most important thing, and I think this is where when we go with the grants, is to really look at respite. That is, again, a break for you, the caregiver. These are some of the things the grant pays for. I just want to make sure I touch on all of these. Personal cares. One thing I'm really delighted to help people with is sometimes people are doing a really good job caring for a parent, and then I'll get someone who just says, I just am so uncomfortable giving mom or dad a shower. For one of 2 reasons. Maybe the size and ability of that person makes it difficult, or maybe it just doesn't feel like a boundary that somebody feels comfortable with. So that is something that people might often ask for with the grant, is to have a home care worker who can provide that kind of personal cares. Or sometimes people need even something more on a medical side of things, and they can get help with that particular care that they're providing. Homemaker is a category that we talk about that encompasses somebody coming and doing deep cleanings, maybe just a weekly person to clean. We have, somebody might come in and now there are services where people will come in and make meals. And even just companionship can be something that the grant can provide. Meal preparation or delivery. Sorry, I got ahead of myself there. And then what we want to make sure is that caregivers have, if it's at all possible, free time for hobbies or things that they love to do, have classes or activities that they love to do. If you're a person who does music, whatever you're interested in, that doesn't leave your life because you're a caregiver. How can we help you bring that in? We have had people do everything from meditation classes. People have used it to do their music. People have used it to do yoga. People have used it for, other kinds of classes that they have enjoyed. So as a caregiver, they're taking care of themselves. Self-care services, massage. We have a lot of people who use their funding for massage to make sure that physically they are caring for themselves. Exercise and relaxation. This is a favorite one, particularly for grandparents. They can, their grants have purchased family memberships at the Y, which is wonderful for the whole family. People get exercise and families have enjoyed activities together. So that's an option. And just free time to connect and socialize with other people is really important. So we've had people who just need the, afternoon a week that they go out to lunch with friends and a movie, or they go for a walk, or some people who love to bike, take an afternoon and bike. However that you would want to take that time that would allow you to have your life remain part of what you're doing and not having caregiving take over every aspect of it. As I mentioned, the supplemental services are things like assistive devices. Falls are a big deal. So anti-fall kinds of technology, home modification. Every time I look at this, I think, I wish that was my bathroom. It's much cooler than my bathroom. But things like grab bars, 0 level entries, a higher, taller toilet. These kinds of things could really make a difference when you're caring for someone who's really losing more mobility. And chores for home upkeep. One thing that was interesting when all the ashes started coming down, the ash trees, We actually, one family just decided they needed to take down an ash tree that could have potentially fallen on their parents' house. So the grant even was able to be used for that kind of a service as well. Additional resources, I haven't mentioned, excuse me, the Alzheimer's Family Caregiver Support Program. If you haven't heard of that, oftentimes we work together. So depending where you are in the state, the caregiver specialist might administer both of these grants, might administer one or the other. In my case, I administer this NFCSP, which we're talking about today. And the Alzheimer Family Caregiver Support Program is administered under the ADRC under Kayla Olson, who's a dementia care specialist. Again, call the ADRC if you have interest in this grant. This one is different. It is from the state. It's state funded. It's not a national grant. It is a grant that looks at the family who's caring for a person with Alzheimer's. So the focus is just a little bit different. And that family income needs to be, it cannot be above $48,000. So those are the parameters for it. So dementia diagnosis, again, if you don't have a formal Alzheimer's diagnosis, which doesn't always happen, even a note from the doctor saying what they're seeing with your loved one can be used. So Kayla can go through that with you. You can have that grant and the grant, the NFCSP grant, in a single year, but not at the same time. So that can offer extra support to those who are caring for someone with Alzheimer's or dementia, which is, as we know, can just be a 24/7 operation for families and for people, depending where things fall in the disease process. So Kayla and I can coordinate it. If you're looking at another county, they will tell you how you can coordinate these two. So if you are caregiving for a loved one who has a dementia diagnosis, this is an option. The Respite Care Association of Wisconsin is kind of an incredibly wonderful organization. I can give you the information to contact them. They're rcaw.org online. They have training programs, but they also have grants that they dovetail with these federal grants and state grants, in that once, if you are turned down for one of these grants for any reason, you don't qualify for some reason, the money is gone, or you've used up this funding, you can then go to them and go through their process, and they have both respite and supplemental grants, and you can apply for those, and those are available to you as well, all over the state of Wisconsin. It's a really wonderful organization. I strongly suggest you can check out their website. It is care across the lifespan. So if you're caring for a child with a disability, etc., all of that gets addressed by RCAW. Senior focal points, if you haven't heard it used in that way, what we're simply talking about with that is our senior centers, our senior coalitions. They sometimes have home chore funding that they can provide for your loved one. They can give you case management if you qualify. So in other words, help your loved one navigate what they're going through. So they would be more the place where your older adult loved one would be based. And oftentimes their case managers at the senior centers are the ones who are referring caregiver family members for the grant and work with us. An excellent way to connect, and also to find out what might be available for your older adult loved one. The ADRC, here's their number. That's the one in Dane County. Again, if you don't know where to start there. Excellent staff who will direct you. There are support groups all over Dane County. We have listings online. Both the ADRC and the Area Agency on Aging have them on our website. So again, we could direct you to those. They're all over, and they cover, some are specific to Alzheimer's and dementia, some towards Parkinson's or particular illness, some are just for general caregiving. And there is also at the Rainbow Project in downtown Madison, a grandparent raising grandchildren group that is a very supportive group there. And then I just wanted to mention the Wisconsin Aging Advocacy Network. We talk a lot about how critical it's going to be that caregivers begin to do advocacy where they can. I know they're so busy, but I am old enough to remember a long time ago when they didn't do much for childcare, when workplaces, when there wasn't much of a break, there was certainly not such a thing as paid leave when you had a baby and you were working, and people spoke up about that. And I think a huge place to speak up is if you're a person who's still working, caring for a parent, speak up at your workplace. Let them know that to you, it's really critical to have them look maybe at paid family leave with more flexibility, what kinds of flexibility you have, that's really an important thing to you. If you're the kind of person who likes to get involved, certainly there's a lot of organizations we can point you to. I think it's really important to begin to speak up. I was just talking to Mike before we went on that Kamala Harris is talking about the potential of Medicare to cover some kinds of home supportive care. I have no idea what that would look like, but the fact that people are talking about this is really important. And make your feelings known when you have an opportunity to talk. Also, the area plan for our triple A's is just going on this year for the next 3 years. And so, providing input, what kinds of things do you need? What kinds of support do you want? So I also, let's see, I think I have one more thing here. I publish Caregiver Chronicles quarterly in print, and monthly there's a bulletin, and really what that is just simply what's going on for caregivers. There's usually 1 or 2 articles in there that might be some good information for you. The MIPA Moments that talks about Medicare is always in there as a monthly column. There are no ads or anything, but there are flyers for events coming up and such. So if you have any interest in receiving that, if you need it by mail, let me know. But if you just want to be on the list for the email version, I'm more than happy to send that. Just shoot me an email. And this is my information. I'll leave it up for now. You can feel free to call me. You can feel free to email me, and I will get back to you. I generally do a lot of my own. I do all of my own intake, which means you can't always get me live. I might be on the phone, but I will get back to you. If there's anything urgent, I would always, again, call the ADRC and tell them, or I'd have them, again, refer back to me. They certainly will. I hope I didn't talk too fast. I hope that there was something here you could use, and please feel free to ask any questions. And again, if you have remaining questions after this, if you had a chance to think about this, please give me a call. It's a great time of year. We're going to start gearing up for next year's grants. So thank you. And if you have questions, happy to take them.
Super. Thank you, Jane. That's a lot of information. Everyone, please feel free to unmute yourselves and ask questions while we have a chance to get a word with Jane. I have to say, she gets back in touch with everybody, but it might take a day. So we've got her here right now. Please feel free to jump in. Then I'm going to. Jane, the thing that I'm concerned about is caregiver education. I mean, I remember when my dad became, unable to care for himself, but he had a bad case of dementia, and so he, went into the nursing home right away. So I guess I didn't have to worry about taking care of him, but not everybody's like that, right? I mean, as you said, you took care of your dad for a while, and he was like a lot of men, they don't think anything's going wrong, and so how does a caregiver become a good caregiver? I mean, all of these resources look like, geez, this would really help me get up to speed, but how does a caregiver learn about them other than, we have you here for the hour? How could somebody get, I guess call the ADRC, but that's a big office. Do they have a sheet of stuff that they can send you? How do you do it?
Well, I think there's a couple of things, particularly if you're caring for a person that has dementia. We have dementia care specialists. All of the various offices do around the state, the ADRCs, and they're some incredible people. And they are constantly giving programming. So I would say, you know, you can make a consultation with one of the dementia care specialists. They have both ongoing educational groups, and they have just a huge amount of material that they can refer and provide for families. For very general caregiving, I think I would just say you could look at the Respite Care Association of Wisconsin. They have a whole training module that's free that you can look at right on there. And also, I guess I would still check in with the ADRC for what programs are coming up. Look to your senior centers. They have a lot of good programming if you subscribe to their newsletters. And again, I think that you've pointed out a big hole in what we are trying to find more resources for, and that is general caregiving stuff. So if you're talking about something more medical, we have connections like, I don't know, using a gait belt, something like that. We have more connections with folks at the Department of Kinesiology at UW. They have student clinics there that are free, that people can come in and even get PT and OT, and also learn to do some of these things. So I think we would just try to help point you into what you specifically wanted, but I don't know of a big clearinghouse that you can just look at everything. It's definitely for dementia care, but not as much in the whole wide world of all the rest of issues.
Mhm. Mhm. Go ahead. Anyone else? Otherwise, is it the same in all counties, Jane? I mean, we're here in Dane County, but say in Iowa County, would anything be different? Or I mean, they face the same problems, right? I mean, people are sick, they need care, they need money to do it.
We all have grants to give. So every county has grants. They might have a bit of a different process for how they do it, but they have Alzheimer's Family Caregiver Program, and they have National Family Caregiver Program funds. So I would call their ADRC and get them to the person who does their caregiver work. So sometimes they're housed, you know, if they're a county that's one of the 70 that are not their own, Milwaukee and Dane, that the person like me is housed in the ADRC.
I see.
Jane, my name is Lisa. I'm actually from Milwaukee County. I'm down in Oak Creek. And I do a lot of talking at various senior centers. We have a brand new senior center here in Oak Creek at the Salvation Army, and I've been working with the coordinator there. I go and speak about once a month on various topics, and I know she has been trying to find funding. You're talking about grants that I know are for individuals, but are there grants available for senior centers, things like that, to bring in speakers to do various programming?
Yes, there absolutely are. And I can look a little further into it if you want to check with me. But I know also that the Respite Care Association of Wisconsin has a couple of them, and they're on their website that
Okay.
organizations can apply for to do this kind of work. And so if you look, they have a big menu right across the top, and you'll be able to look under their different programming and grants. And when you go to their grants page, they do have a section on organizations and what they can apply for.
Okay, thank you.
Hi, I'm Bonnie Ackerman, and I have a question for you. First of all, who is ADRC that you keep referring to? And how do I contact them?
Yes.
Also,
Oh, I'm sorry. Go ahead, Bonnie.
and then second part is, I don't need a grant, but I am looking to age in home. And I need information about, I have somebody who is willing to be my caretaker. I live alone, but I need to know more information. I like the statistics that you had as far as how many people end up with needing long-term care, those kind of statistics, and also payroll information, so that I probably will not need, fortunately, I'm not needing a grant, but I need to be able to find services, other services that she cannot provide for me, and what kind of a payment schedule there is.
Sure. Well, Bonnie, I'm sorry, I just made an assumption about the ADRC. They're the Aging and Disability Resource Centers. That's what the ADRC stands for. Every county has one in Wisconsin. And their mission is to provide, to connect people with resources and provide information. So when you call, they will refer you, they will hook you up with things. So if you want to know, have a list of providers, things like that, I can do that for you too, but they can also do that for you. Provide that. Any statistics that you want specifically, please let me know. I will be happy to share those. And I can also, make my, my PowerPoint. I don't know if that's unwieldy for people. I could make anything available, but I could certainly just put it in a list or something for you and get you that information.
Great, I'll give you a call.
I'm sorry?
I can give you a call and we
You
can.
can give me a call. You absolutely can, and look at more about what's there for you. But I just think you're really wise to plan. And, that's one thing that any of your caregiver coordinators or specialists can do is they don't have to just do a grant. We can also work with you as a caregiver and help you connect you to some resources as well.
Perfect,
Happy to
thank
do
you. It's a great program.
Yeah, I just have to say the ADRC has a ton of stuff. And so, I mean, even if you're just browsing their website, familiarize yourself with all that they can do to help us. I put that link in the chat section, so feel free to click on that.
Okay.
What other questions? Go ahead, please. Anyone?
I don't
Dana,
really have a question. I'm sorry. I can't get my video and my microphone working at the same time. But my name is Kate Steele, and I do work with Mike at RSVP of Dane County. And I just wanted to say thank you so much for these resources, both from a professional but also from a personal standpoint. It is so wonderful to know that these options for grants and for resources is here. And I'm just really appreciative of you being here today to share that with us, because we will definitely be using this information.
Thank you. Thank you. Glad I could be useful. And this is a passion for me, so I enjoy it. Please reach out.
Thank you very much. And you said you are not with the ADRC?
We are co-located. So in wherever there's a AAA, that's separated out. So that's kind of institutional, but you don't really have to keep it in your head. But I'm part of the Area Agency on Aging.
Okay.
But we're right there in the same building with the Aging and Resource Disability, the Aging and Disability Resource Center. So
Okay.
we're under a big umbrella with the county, but we're separate agencies.
Okay, great. And Mike has your information so that if anybody needs it, we can reach out to Mike to get your email
Yes.
address or your
And phone. Yep.
Great. Okay.
Absolutely.
Thank you so much.
I have one more question. I was just thinking when you mentioned this umbrella, do you have some kind of a listing of starting with the umbrella and what agencies are under that umbrella that people can contact for certain services?
I think we could talk about that. Like if you connect with me, I will see what I have. I don't have something that I know is created right now, but could certainly do that for you and show you and explain to you
Okay,
where to
you.
connect.
Okay, thank you very much. It's great.
Yeah, I understand if you just go online, sometimes you can just really go down quite a rabbit hole. So happy to be as direct, help you be as direct as you can.
Thank you. Great program, Mike. And
it's all thanks to Jane, really. I just talked with Amy Scarr at the Adult Protective Services, and she pointed us toward Jane. I mean, just a little networking. And so, I invite anyone, if you have suggestions for programs, please let us know. Not just a topic, but I can think up all kinds of ideas I'd like to have some information about, but everybody has contacts, that they'd like, to offer. And so please let me know who we can bring on. Any other questions, please go ahead. Got a few more minutes left here, a couple more. Okay, Jane, well, we're going to burn those 2 minutes, let you have a cup of coffee here. Okay, so everyone, thank you very much for joining us today. I really appreciate it. And Jane, thank you so much for offering us this hour and all of the fantastic information in it. Appreciate it.
Thank you all, and thanks to all the caregivers and everyone who's supporting them. I appreciate
you.
it too.
Thank you so much.
Thanks.
Bye-bye.
Bye-bye.